Okay, recording now. Hi, this is Dr. Tyler Andre, and today I'll be running you through another one of the military cases. This one is heat stroke, and we're in kind of a tent environment. First thing I'll let you do is kind of orient yourself to the environment. You can kind of see outside. Okay, got the wind blowing over there. We got a patient in front of us. Got my hands using the index trigger button, open and close. The X and A buttons will kind of make a pointer finger here. Okay, and you can see we've got all sorts of different tools that are interactable. Whenever you hover over a tool, it will turn green, which lets you know you can pick it up. And then there will be colliders on the patient that you can use that tool to interact. Okay, so first thing we'll do is we'll start by talking to the patient. In Simex, you just want to be able to communicate like you would in real life. So, hey, sir, what's your name?
I'm Tom Barnes.
All right, Mr. Barnes. What's going on today?
It's just hard to think clearly. It's just hard.
All right,
I've
you
been
can
out
tell he's a little bit
working on a
confused here.
construction
Let's
project
first
for
start
the
by
last
disrobing the
few
patient. So
hours,
if I
and
hover my hand
don't know,
over
I
his
was
clothes,
just
they glow
getting a
green.
little
I can pull the index
confused,
trigger
I
finger
guess.
button, and I can remove both the shirt and the pants. Okay, and let's start by maybe getting some vitals. So we can take the monitor stickers and deploy those on the chest. I've got a pulse oximeter here. I can put it on his finger. I can read it either on the finger or on the monitor. He's got good oxygenation. And let's go ahead and let's put a blood pressure cuff on him. Okay, you can tell that that's cycling. And by hovering over my stethoscope, it turns green. I can pick it up. If I let it go, it returns to where it started. And we can see the different places the stethoscope can interact on his chest. Good, a little tachycardic. Listen to his lungs either on the sides of his chest or coming around behind. Okay. Last vital sign here. Let's get a temperature on Mr. Barnes. Forehead temperature here at 105. Okay, that's much too hot. Mr. Barnes, I'm worried that you might be having some heat stroke or heat exhaustion. Let's go ahead and we'll do a neurologic exam. I can grab a pen light here that's in the drawer. And by shining that into the pupils, we can see that they react. Will you open your mouth for me? Let's look in the back of your throat. Okay, good. Let's have you puff out your cheeks. Okay, good. Can you stick out your tongue? Good. All right, let's have you shrug your shoulders. Good. And raise your arms. Okay, I can also do extraocular movements by either pushing the X or the A buttons on my controllers. That'll make a pointer finger. If I get close, I can have him follow as I track left, right, up, and down. Make him go a little cross-eyed. Whoa. Okay, let's do a finger-to-nose exam while we're pointing our finger. Mr. Barnes, will you touch the tip of your nose and then touch the tip of my finger here? And you'll see he'll try and track my hand as it moves around. Okay, so his neurologic exam's doing okay, but he's having some memory issues. Mr. Barnes, do you have any other medical problems?
No.
He's answering that. We'll grab a IV here. Let's place an IV in his right AC. And then over here I've got some lactated ringers that are hanging. We'll go ahead and we'll connect that up. And you'll notice as I do all of these things on the moderator screen, they check off as objectives that I've accomplished. Okay, let's place cold packs. Maybe in his armpits. We're going to put some cold packs here for you.
Ooh, that's cold.
Yeah, it is a little cold. And in my med cabinet over here, I have a squirt bottle. Okay, grab some sterile water for irrigation. And I can spritz this on Mr. Barnes. All right, we're getting you kind of wet here, trying to get your temperature to cool down. I've got a fan, and we're going to turn that on. We've got some different settings here. Okay, we'll crank that all the way up. There we go. Oh, keep turning it off. Okay. Just a couple other tools that you can interact with. I'll show you how to drop some
Definitely
medication.
feeling a bit
Let's
better.
say that maybe this gentleman was in a lot of pain. We could give him some fentanyl. Pick up the vial, grab the syringe, we insert it in the vial, and using the joystick, you can draw back the amount of medication that you'd want to give. Now, fentanyl's pretty concentrated, but, you know, that would be if I wanted to give 10 mLs. Okay, let's say I wanted to waste some. I could use the same joystick to push the medication out, and if I wanted, I could go administer it to the patient. Okay. Let's go ahead and we'll call for medevac using our radio. Come in.
This is MedEvac.
Hey, this is Dr. Andre. I'm here with Mr. Barnes, who's got a temperature of 105. I think he's having a little bit of heat stroke. He's kind of confused, and we need to transport him.
Are you sure they need to be transported?
Yeah, he's having some altered mental status. His temp's real high, and his blood pressure actually is a little bit low. We're giving him some fluids. We've placed cold packs. We've gotten him wet and turned on a fan, but he probably needs a little bit more definitive care than we can give.
All right, we can get a transport team to you in about 15 minutes.
Perfect. Thanks so much. Okay, and that's kind of how we run the heat stroke case. I'll let you guys go ahead and try it on your own, and happy simming.